I'm Sydney Greenwell, and I have reactive attachment disorder. So I chose reactive attachment disorder because working in a public school system, you see a lot. So K through 12, I saw kids experiencing multiple different traumas and all walks of life. And this isn't a disorder I knew much about, so I wanted to take this opportunity to learn about it. So, the overview of the disorder and diagnostic criteria. According to the DSM-5, reactive attachment disorder is seen in children who present with socially and emotionally withdrawn behaviors. They have persistent social and emotional disturbances and patterns of extreme inconsistencies with caregivers and not having their basic emotional needs met. So, some of these key symptoms with the diagnostic criteria that fall under those three tiers would be that the child doesn't seek comfort when distressed, so they don't go to their caregivers, an adult, for comfort when they're needing it. The child will likely not respond to comfort if it is given to them in a situation from an adult. Little to no emotional response to others, whether that be peers, adults, friends. They have lack of a positive affect, whether that be flat affect, sad. They have unprovoked episodes of irritability and sadness, even with non-threatening situations with adult caregivers. They have persistent lack of basic emotional needs being met by their adult caregivers and frequent changes in caregivers, whether that be strangers, foster care, adoptions, daycares, just the frequent change. Prevalence and impact. So this disorder is actually a very rare condition, and the DSM-5 does state that the prevalence is actually still unknown, but it does go on to state that this disorder is generally only seen in young children from 9 months to 5 years of age, and those children who have been exposed to severe neglect associated with a foster care, orphanages, inconsistent guardians, caregivers. And they do say that even with that, it is only seen in less than 10% of severe neglect cases. And now the impact it has is different on the individuals as well as the families or caregivers. So the child may struggle with trusting their caregiver, emotional outbursts, inadequate coping, while the caregiver may struggle with trying to provide that care and love and support that they know that this child has, that they know this child needs from their traumatic past. But with reactive attachment disorder, the child is not going to respond as a normal child would. So treatment and intervention, the Mayo Clinic does state that there is no standard treatment for this disorder. However, we would want caregivers and the child to be involved in the treatment process and to ensure the best possible outcome together. They also state that treatment strategies such as consistent caregivers, positive environment, individual and family therapy, so the child and the adult go to therapy individually and then they come together and go to family therapy together. And then also classes for the parents or caregivers just to provide them the proper education on reactive attachment disorder because it is so rare and unknown. So goals with these treatments and interventions would be to ensure safe, stable living situations, and the child can develop positive interactions with the caregivers and adults. While current research does suggest that we know this is a very rare disorder, and there's not much known about it, we do know that it has to come from a place of severe neglect, and it is difficult to diagnose. So it is often diagnosed by trial and error through therapy, counseling, treatments of other emotional or behavioral disorders, such as like autism, ADHD, oppositional defiant disorder, other neurological conditions, just because the symptoms are often overlapping, or those have to be ruled out before you reach the diagnosis of reactive attachment disorder. Research also suggests that even with interventions, children who suffer with this disorder, reactive attachment disorder, will still struggle with their everyday lives. So, making friends, developing their sense of self, and case studies often prove how difficult it is to diagnose reactive attachment disorder. And that will bring me to my next slide, my case example of the 4-year-old boy who was adopted at 8 months old with a history of severe neglect, who presented with uncontrolled behaviors, attachment issues, emotional dysregulation, symptoms of ADHD. And while his history isn't completely known, it is known that he was taken from his biological mother at 7 months old due to the severe neglect, and believed he was left unattended and crying for long periods at a time. And he did stay with his aunt for a period, and then she decided she was unable to care for him, and he was later adopted by the owner of a daycare he attended. So he was taken to two different psychiatrists and a primary care physician for these behaviors he was having, and he was diagnosed with multiple different disorders, and multiple medications were prescribed, such as guanfacine, fluoxetine, methylphenidate, amphetamine salts, and through trying those saw that there was little to no improvement. So I just think this goes to show that it's how difficult it is to diagnose reactive attachment disorder because of the similar behavior disorders, which can lead to years of improper treatment like it did for this child. So, in conclusion, we know that less than 10% of these severe neglect and abuse cases are diagnosed with reactive attachment disorder, whether that be because it's just difficult to diagnose or because it's just that rare. It is also stated that children, when they grow up with reactive attachment disorder, they later in life will have other psychiatric comorbidities. ADHD, one of that, is generally diagnosed alongside reactive attachment disorder. It is also stated that they have higher chance of substance use, suicide attempts, and psychiatric hospitalizations. But for the mental health professionals, it is important for them to understand reactive attachment disorder because of the other mental health conditions or conditions throughout the DSM-5 that are overlapping in symptoms and have similar presentations as reactive attachment disorder, so that they can provide the proper treatment and proper diagnosis for these children to ensure the best possible outcome. So the sooner they get treatment and therapies that they need, they can create the proper bond. Because if they're getting the wrong treatment, it could exacerbate their symptoms of reactive attachment disorder. And my references page. Thank you.